At 6, with a fight against the Trump administration budget bill, Iowa Democrats are asking senators in Washington to vote against it because of what they say it'll do to the state's health care. Iowa's News Now State House reporter Skylar Talal is getting a closer look at what could happen.
President Donald Trump's budget bill that passed the House and is still waiting on action from the Senate includes funding cuts to Medicaid and new work requirements for able-bodied Americans. Iowa Democrats fear the changes could put Iowans' health at risk.
Medicaid isn't some abstract government program. It's a lifeline for over 600,000 Iowans, including thousands of working families, kids, and seniors that live here.
Iowa's GOP House delegation voted in favor of the bill, claiming it gets rid of fraud, waste, and abuse. Back when the bill passed, Congresswoman Marionette Miller-Meeks said it would strengthen Medicaid for the vulnerable, but not for those who can work and choose not to. But Democrats say the changes to Medicaid will end up hurting vulnerable populations. According to the Kaiser Family Foundation, Medicaid in Iowa covers 38% of births and 50% of nursing home residents.
Looking at nursing homes in our state, which is already in a crisis, both when it comes to the quality, with inspections, when it comes to bed availability, when it comes to staffing shortages, all of that is going to be exacerbated with these Medicaid cuts.
Opponents say rural healthcare in Iowa is already struggling, and with data showing 42% of Iowans enrolled in Medicaid live in rural areas, they fear these changes could make the situation worse.
It's a huge worry for us in rural Iowa. You know, in a way, it was brought up this morning that it really puts us in limbo because we can't really make a plan going forward strategically of what services best fit our community and our needs because we don't know if the funding's going to be there.
Governor Kim Reynolds recently signed 2 bills passed by state lawmakers with the goal of improving health care in rural Iowa. They increase residency spots, create new loan repayment programs for hard-to-fill positions, and expand safety protections for healthcare workers. In Des Moines, Skylar Talal reporting.